We now begin a press briefing by Prime Minister Suga. First off, we hear from Prime Minister and followed by questions by reporters. The floor is yours. Today, I'm here to talk about COVID-19 to people, especially where we are now and what exactly we need to be careful for New Year holiday period, as well as from my requests. The combat against the COVID-19 has rumbled on for almost a year. That this is the first winter, especially in Tokyo areas, infections are rising. The infections were over 3,000 per day, which remains high even today. And I do know you are more and more concerned about it. First of all, let me say that medical professionals on the front line and people in care homes and all the people in Japan, let me respect and appreciate for their efforts. And all the while, on a consistent manner, Dr. Omi and other experts have given us advice so that we need to protect life and living of people, and we have solely addressed on countermeasures against COVID-19. Job adjusting subsidies have been issued to protect jobs and maintain businesses, and these efforts have carried on. And up until today, unemployment rate is just 2.9% versus other foreign countries, which is quite low. Restaurants' business hours have been requested to shorten, and go-to travel were suspended now, and remote working had started to gain traction, and we have gained so much cooperation from the people. I truly appreciate all the efforts. Now, against the backdrop, I had dinner the other day, covered by media. I was supposed to be in a position where I have to request for people to hold back such a dinner. So I need to apologize on that. As you all know, this month, the traffic in Tokyo remains the same. If that stays the course, it is likely that infections will be on the rise. Starting tomorrow and year-end and New Year holiday period, I encourage all of Japanese people to cooperate with us. Quiet and calm New Year holiday period is something we want as a government. I know there are many occasions that family members and acquaintances and friends will come together, but I'll ask you to hold back such outings, and by any means, we would like to contain this outbreak of COVID-19 in this period. So this is another request from me. In this period, medical arrangements have to scale back. We need to minimize and alleviate the burden on medical professionals. That takes each and every one of your cooperation. As a Japanese government, doctors and nurses supporting funds have been raised, and 15,000 yen for doctors and 5,500 yen for nurses will be supported per hour, and 270 billion yen with the fund, we will give support for hospitals who take COVID-19 infections urgently. We need to support them. So 20,000 beds and 15 million yen will be delivered for those beds. So capitalizing on these funds, we need to increase the number of beds who can take COVID-19 infections and improve their treatments so that needy people can take necessary treatments. So we do all the efforts to make sure those medical services will be delivered.
During the process, on a constant basis, there has been a point made from experts, which is about the infection risks in drinking and eating establishments. About 60% of Tokyo infections and the invisible ones, many of them are coming from these establishments. And as anti-infection measures, the most effective one is shorter working hours for those establishments. And we have had a collaboration from those establishments, drinking and eating establishments. And thank you very much. And I feel sorry at the same time. In each location, we'd like to solicit further collaboration so that we can normalize things to the situation before COVID-19. So the support, 600,000 yen per month to 1.2 million. So there was a doubling of the amount for support, and up to 40 million unsecured and no-interest loan has been provided, and the different options are available for support and assistance. So once again, thank you so much for your assistance and cooperation in advance. And the shorter working hours for those establishments, the benefits and or subsidies and punishments will be combined so that we can make it more effective, and we will devise the special law or special measures law. However, regarding the fines and the punishments, so there are different opinions. So tougher regulations have to be introduced, and there are also some precautions which are called on. So in the subcommittee, we'd like to accelerate our study. And border control measures will be also enhanced in the UK. We have witnessed a new variant. And regarding this issue, since yesterday, the foreign residents who have a history of residing or staying in the UK, we have enhanced our measures. And then also the foreign citizens who have stayed in the South Africa, just like the UK, the entry ban will be in scope. And going forward, we'd like to protect the livelihoods and the lives of the Japanese people. With that in mind, we'd like to see the situation in each country so that we can take swift measures and enhance our measures. And at the end of the day, anti-infection measures will be determined by vaccination. And in the US and other areas, we have had inoculations which started, and we have some clinical trial underway. In February, the data will be compiled. And then later on, safety and efficacy will be confirmed. And with that as a priority, we will screen the vaccinations. And once it is approved, we will deliver it to necessary people as soon as possible. And we'd like to unite all the efforts across different ministries and agencies. And about Go-To campaign, in April, there was a launch. And across the board, 70 million people have used the services. And 340 people infections were discovered. And there was a big contribution to economic and social activities. Last month, the experts gathered, and we had our suggestions from there. Hokkaido, Osaka, and Tokyo. We had our temporary halting. I went through many thoughts, and afterwards, I reached a decision. And for New Year's and year-end period, we have to have intensive measures in place. And for some time, we have decided to hold this event of this campaign for some time. And about the Go-To events or campaigns from local people, there was an encouraging message. On the other hand, anti-infection measures and Go-To being combined gives concerns and some sort of ambiguity. I was reprimanded, and I myself, regarding anti-infection measures, I think that there is a sort of lack of explanation to the people of Japan on this front. So going forward, to Japanese citizens, I'd like to clearly communicate my message. Since the inauguration, 100 days have passed. And in the presidential election, as I committed, first of all, COVID-19 anti-infection measures will be my first priority. And then, for a long period of time, there was a deferral of many challenges. For example, green society and digitalization of the society and the dropping birth rate and others. We need to find solutions so that we can give a blueprint for the future in specific manners. So we have done everything that we could.
来月から
Infertility treatment starting next month, the subsidies amount will increase and we will scrap with any cap on income, and starting 2022 we will cover them with the insurance. And mobile fee rights, major incumbents started to launch 2,980 yen for 20 gigabytes, and those contracts started to be displayed by major incumbents. In order to make bright steps forward, we need to contain the COVID-19. In April, we had an emergency declaration. In summer, infection spikes. We had a series of requests and cooperation from you, but once again, you and your family members and your loved ones' life and living need to be safeguarded. So up until the vaccination starts, medical readiness need to survive these hardy times. So that necessitates a quiet and calm holiday period. Family members and loved ones in a small number and manner, we expect you to spend in a calm and quiet holiday period. We need to abate this COVID-19 as soon as possible so that we are able to go back to the pre-COVID age and with the hopeful days and societies, and that's something we need to realize, and we need your cooperation. That concludes my speech. Thank you.
それではこれから皆様
With that, I'd like to entertain questions from reporters. In asking questions, I'd like to have Dr. Omi and Prime Minister Suga answer 2 questions. Dr. Omi, could you please move to the set position, please?
First, 最初は慣例に従います。
First, we will entertain questions from the 2 leading outlets. Once you are given the go, please approach to the closest mic and identify yourself with the name and affiliation. So TBS, Goto-san, please go ahead.
幹事社 TBS の後藤と申します。菅総理をお尋ねします。政府のです。
This is Goto from TBS. The question for Prime Minister Suga. The end of November, you said it will be the 3 weeks of tested 3 weeks, and you asked the people to hold back the actions. However, the momentum of COVID-19 has still continued, and Go to Trouble campaign has been suspended across the board, but which was too late, some people said. And also in a speech, you said you had a dinner with a large number of people and you extended apologies. Why do you think this COVID-19 infections don't stop? What's your personal view? And what are the things you need to repent on the government's response? And not only that, the special measures law revision, with that in mind, for the next ordinary session, how are we going to be ready for that? Yes, to your question on the amendment of the special measure law, I have to repeat what I read out now. In subcommittee of experts will be where the intensive discussions need to take place. And increase in number of infections. The record levels have been observed. The drivers will be explained by Dr. Omi, which will be a better presenter to talk about it. But as a Japanese government, I have addressed on that, and this is the first infectious disease. Every single day, I encountered the difficult decisions. And then against the backdrop, go to campaign. As I touched at the outset, "7,000 people have used the campaign, and infection was around 350. But then, once that becomes stage 3, Dr. Omi and experts have been requested and urged us to put on hold on go-to campaign. Tokyo, Osaka, Hokkaido, and these are 3 prefectures that we put on hold for go-to campaign. But with my decision, especially on the year-end and New Year holiday period, utilizing this period, I believed that we needed to put on hold the go-to campaign across the board.
Like I said before, about the amendment of special measures, though, drinking and eating are the primary cause, as probably you can ask Mr. Dr. Omi. So as for the government, so shorter working hours of those establishments and benefits and punishments being combined will be more effective as measures. That's our thought. However, we have also opinions and discussions taking place in the subcommittee, so based on that, we'd like to take adequate measures. Regarding the status of infection, why it's not stopping, and what are the drivers? Because of this occasion, I'd like to briefly comment on those aspects. Now, in Hokkaido, Osaka, ahead of the curve, intensive measures and quite a powerful measures were in place, and because of that, in Hokkaido, there has been a declining trend. In Osaka as well, the increasing spend is now abated. In Tokyo, as you know, there has been an ongoing expansion of new cases. In neighboring prefectures, there has been the spread into different areas, neighboring areas, Saitama, Chiba, Kanagawa. As a result, about 50% of the new cases are coming from these areas when you look at across the nation. So around Tokyo and the urban areas, new infections have to be pushed down as soon as possible. Otherwise, we cannot push down the across-the-board new infections. During New Year and year-end period, once it starts, the flow of people will be contained to a certain extent. However, what I have to reiterate here is this. After year-end and New Year period start, we will have more activities of social and economic activities, and we might have, this is a possibility, however, we have a high likelihood of new expansion of new cases. Once again, so now we have to push it down now. And once we have the end of this period, New Year's period, once we have a new and rapid expansion, it will be difficult and take time to push it down. So weeks will not be the unit of containment. So therefore, in order to contain it during this time, we have to do everything that we can. So state and local municipalities and operators and people of Japan have to unite their efforts to take intensive measures to contain COVID-19 expansion. And one more point that I should say is what we should do right now. In April, there was a state of emergency declaration. in April, we have differences between now and April. Number one, as of April, 70% or 80% contact containment and quite a powerful and broad measure was in place. However, because of the experience over the last 6 months, because of such experience, we know where are the key points for the countermeasures. So this is the first difference. And the second difference in between is many people, whether it's state or local municipalities, requests, they are responding to those requests. However, they are sort of getting used to where we are. So now it is difficult to solicit understanding or cooperation in terms of those requests. So I just said key points, and there are 3 key points regarding the countermeasures, and we have to do that in a intensive manner. First of all, there are 5 occasions where we have high infection risks, like I said before, and as Prime Minister has said, through eating and drinking occasions, we have a high risks of infection, so they have to be thoroughly pushed down. And the second point is, even outside of the drinking and such party occasions, in small groups and less than 4 people, and with family members or acquaintances that you always stay with, you have to stick to them. And number 3, national and local municipalities leaders have to enforce and deliver specific messages and measures. So all these stakeholders that I described should join their efforts to push down the current trend. Thank you very much.
もう一社どうぞ。
One more leading media outlet, Oida-san from Mainichi newspaper. After you ask the question, you may go back to your seat. This is Oita from Mainichi newspaper. Thank you. My question concerns the politics and money. Today, the former Prime Minister Abe made a speech in Diet sessions over e-party and its money. However, opposition parties say that's not enough. That was not enough. And do you think that former Prime Minister Abe made and fulfilled the responsibility to explain? And I guess, to the benefit of hindsight, you wound up having the false remarks numerous times in Diet sessions. Could you please be specific in us answering questions? Now, the former Minister of Agriculture, Yoshikawa, resigned because he has received the cash from the representative of egg manufacturers and producers, and house research took place even in the Diet members' building. As a former one cabinet minister, do you think that he need to fulfill the responsibility to explain, and would you like to give a nudge to him to do so? Yes, to your first question on the former Prime Minister Abe. The former Prime Minister Abe made speeches in Diet sessions which proved to be now the false remarks, and I took it very seriously. And I myself, when I was Chief Cabinet Secretary, I made a speech at the Diet sessions many times. On this speech and statements by Prime Minister, the then Prime Minister Abe, should the needs arise, I numerous times checked with the then Prime Minister Abe and made a speech in Diet sessions. However, to the benefit of hindsight, I wound up having false remarks in Diet sessions, and I feel very sorry. So once again, let me take this opportunity to apologize you. And there were various occasions and opportunity in Diet sessions many times, and that will be where I like to give careful accounts. Now, to your question on Mr. Yoshikawa, as he said, because of the heart disease, cardiac disease, as a Diet member, he can't fulfill his responsibility, so he has resigned. And I'm not aware of investigative authorities campaign and activities, so I decline to comment on that. However, the politicians need to straight up their back and need to fulfill their accountabilities. Okay, so now I'd like to entertain other media's questions. Please raise your hand instead of speaking up. I'll give a go, so please approach the closest mic and again identify yourself with your name and affiliations. Please limit your question to one per head. Kasuma-san from Fuji TV.
フジテレビの鹿島
Kashima from Fuji TV on the request to shorten business hours. In Tokyo, new infections exceeded 800 for 2 days in succession. Up to the 11th of November, up to 10 p.m., the Tokyo has requested restaurants to close before that. But what do you think that the need to do that much earlier on? Ms. Koike put some questions on the effectivity, but do you think that if it's needed to do that much earlier on? And one more question on emergency declaration, as Dr. Omi mentioned, and its possibility. Depending upon how the infections are rising, instead of across the nation, but limiting the regions to, let's say, 4 prefectures, do you think is there any possibility to issue a state of emergency? Well, first of all, on your first question, Hokkaido, Osaka, Tokyo, Aichi, currently 14 prefectures currently ask the restaurants to shorten their business hours. Now, as far as Tokyo goes, Japanese government, especially Minister Nishimura, asked the similar requests. And further shortening business hours for these restaurants have been instructed by Dr. Omi. But on this topic, the local government is the final sayer. So not shortening business hours, but instead they might want to do something different. They have taken other measures as well. And you asked a question on the emergency declaration. Dr. Omi had said that we are not in a situation where we have to issue the state of emergency, as far as I know. Anyway, at this stage, with a comparison to the April when we issued the state of emergency, that was when we had to reduce the contact opportunity, and for a while we learned the lessons on what's important, and I appreciate if Dr. Omi can supplement what I have mentioned.
About state of emergency declaration and your question, like I said before, so we know where the focus areas are and where we have to stay focused on, and why we have this trend of infections. In a nutshell, I would say we have economic and social activities going on, and if we had stayed focused more on the measures, key measures, and we'd have been able to contain the expansions. And we really appreciate many people collaborating on this front. However, as a result, we have 3 key focus areas, and we couldn't really stay focused enough on these areas, and that is a very driver for the current infection. So what I have said before is we have to do what we are required to do in terms of these focus areas, and state and municipalities have to unite their efforts in terms of delivering consistent message so that people can go in the same direction. This is a very requirement. Otherwise, after a New Year's period ends, with a very high likelihood and probability, we will have a rapid expansion of infections. In order to contain such a movement, at this point, we have to stay focused on what I have just described so that we can bring a downward trend to the infections. Okay, now we'd like to move on to the next question. Yoshira-san from Kyoto. Yoshira from Kyoto. I'd like to ask Prime Minister about the dissolution of the diet and the COVID-19 and in a TV program. So unless we can contain COVID-19, we shouldn't dissolve the lower house, you said. And vaccination of COVID-19, the dissemination or the spread of that across the nation, do you think it will have an impact on your decision over dissolution of the diet? For the time being, including the inoculation of the COVID-19 vaccinations and COVID-19 anti-infection measures, so these will be the areas of our focus for the time being. And by next autumn, we have a time limitation in terms of the dissolution of the diet. So therefore, first of all, my responsibilities for people of Japan is to contain the COVID-19. And then, so what will happen afterwards? So I shouldn't give you an answer based on hypothesis. However, containment of the COVID-19 is a very important matter now. So now we'd like to take questions from other outlets. Radio Japan, Ito-san. Radio Japan, Ito is my name. I'd like to ask about securing vaccinations and the current timeline for inoculation. Where are we? First, because of what we have done before, from 3 pharma companies, 290 million doses. In terms of 2 rounds, 145 million people will receive some vaccination. So there was an agreement, and from Pfizer, on the 18th of December, there was a submission process for the approval, and the 2 inoculations were ended in the domestic clinical trial, and by February next year, the data will be requested. And based on such data, there will be a screening process and a review process, and once approval is given, the healthcare professionals will be given the first priority, and the elderly, and then the people with underlying conditions and the health workers. They will be prioritized. They will be inoculated for free of charge, and the cost will be covered entirely by the state. In particular, Pfizer, minus 70 degrees Celsius. And so the storage and the transportation-wise, this degree and temperature is needed. So from each ministry and agency, we have formulated a team in Prime Minister's office so that inoculation is activated as soon as possible after approval is done. We have such a structure in place.
のご質問に行きたいと思います。
Moving on to next question on Yoshino-san from TV Asahi. This is Yoshino from TV Asahi on the pace on COVID-19 anti-infection measures. Especially you touched on the vaccination. Do you think it's possible to have an inoculation in February? And next question on the special measures law. And on TV program, I guess you touched on that just now too. When do you think it's possible? And on this at pace before submitting bill, the need on the legislation seems to be in line with whether it's a ruling party and opposition parties. And do you think you need to have a coalition and a pre-discussion before that? Well, there was a liaison and discussion meeting between the 2 blocks. So economic measures and other things, all the areas we master opinions, and anything we heard from it will be the basis to make decisions. So while getting those proposals, we need to make a study and decisions. So in that way, I need to continue to address on that. And vaccine, as I said, up to February, the primary data will be out. So as soon as we have those data available, and then the applications will start, and then go into the process of vaccination. Therefore, in that sense, efficacy and safety need to be proved by data, but it really depends on how much of them can be proved. But data is important in that context. As soon as possible, that's what I can say here. Apologies. Let me limit your question to one. Well, as soon as possible, that's what I can say. Thank you. Other questions? Otsuka-san from GG Press. Otsuka from GG Press on border control. You said South Africa will be covered by the border control, reinforced border control. But new strain has started to expand into other countries. How do you see the need to do so in other countries as well? Yes, of course, the United Kingdom and South Africa were self-evident, but other cases started to emerge, which is to my awareness. So while we confirm them, and border control is something we need to promptly work on. All right. So other foreign press. Peter Landerson from Wall Street. This is Landers from the Wall Street Journal. You talked about green society and its strategy. As far as I hear, in 2030, by the mid-2030, all cars need to be electrified, and gasoline cars won't be ever accepted by Japan, and such a new announcement seems to be made. And Toyota chairman said, abruptly, if we shift to the EVs, and the business model in the established sector might collapse. So that's what the chairman of the association expressed. How do you counter to those opinions? Thank you. Yes, I have seen the media news, and I have read the article by Mr. Toyota, and I myself checked with it. Rather, Prime Minister Suga put a primary pillar for the carbon neutral, and which is thankful and grateful for auto sector, and they will do all the effort to shift to those business vision. So in 2050, we try to realize to be carbon neutrality. This is not the constraints on economy, but this is a driver for growth. So economy and environment is a two wheels we need to run for.
Now we'd like to move on to the next question. Yamiri, Kuromi-san. Kuromi from Yomiuri newspaper. In the beginning, you talked about COVID-19 anti-infection measures, and there was a lack of communication or message deliberation to the people of Japan, and you'd like to enhance the message. In what point do you think there was a lack of communication? And what kind of countermeasures and measures are you going to take going forward? For instance, about Go to Travel campaign. So across the nation, halting was decided, and there is a lack of explanation and lack of speed. So there were such opinions raised, and regarding those areas, I'd like to explain myself in a solid manner. However, regarding this decision, it took a lot of thought process, and I'd like you to understand this point. Shinohara-san. TV Tokyo, Shinohara. Dr. Omi mentioned about the state of emergency declaration, and you are not for the declaration right now. However, now it is becoming difficult to solicit understanding collaboration from people for behavioral changes. However, without such a declaration happening, do you think you can change people's behavior? Is that a question for me? Yes. I myself, I think it is possible. At all different occasions, we need to explain the current situation, and that way, for sure, I think people will understand. Well, like I said before, in April, there was a state of emergency declaration, and a very broad and powerful measures were taken. And retrospectively, I'd say that some of those measures were not necessarily needed because we didn't really know what to do and at that time. However, over time, now we are having more clarity of situation. In this regard, there was a mention of the special measures though, but looking back on the measures that we had, yes, we have the things which are desirable, and whether or not we should state or declare the state of emergency. In this regard, there was a talk about the shorter business hours, and the governor bringing out a powerful and clear message. I think that is important. But at the same time, on the state side, if a request has to be given, then incentives have to be given for people to abide by those requests. Even with the state of emergency declared, without those measures, that would be difficult. So we have response over the last course of 6 months. So we have to scrutinize what was the problem, and we have to stay focused on those pain points. And then special measures though and legislation should come. I think that way we will have more efficacy and more practicality. We'd like to have questions from press club members, non-press club members as well. Internet broadcasting media. My name is Iwakami. So based on what was said by Prime Minister, so we have an abrupt mutation of the variants. And in terms of sense of crisis, I think there's a lack of sense of crisis. I was concerned. Beyond the UK, we have South Africa and Nigeria, where we have a new variants, and there has been a rapid expansion of new cases. And across the world, we have scholars and politicians and experts having quite a hot debate about this area. We have a simultaneous abrupt mutation of the virus. I think this is a new course. And over the last course of 1 year, we have had a development of vaccine, and that may not work, and we have a serious discussions taking place in this regard. Cambridge University Dr. Gupta, regarding this emergence of this new strain, we are having the first step in terms of this new variant strain chain. So vaccine is the last resort. So we shouldn't stick to such an idea. And before that step, we have this simultaneous and abrupt mutation of the virus, and how we should encounter such a new emergence. We have to take it more seriously, I guess. So over the last 1 year, the people around the world was fighting against COVID-19, and in terms of strategies, PCR testing and isolation quarantine were thoroughly implemented, should be thoroughly implemented, and containment. And economically, so China was successful, and other countries didn't do well. And all-out testing was not an approach that Japan took. So I think, anti-China and pro-U.S., of course, there is such approach. However, including such a new emergence of a new strain, and of course, vaccination may not work for such new emergence. However, the testing-wise, I think China method should be seriously thought about, so that we should implement PCR testing across the nation. And we have 2,000 yen, quite affordable package in the private sector for PCR, and that way it will take only 300 billion yen, and 500 billion yen should be budgeted maybe. So we have to be serious. Summing up all the measures over the last 1 year, and we have to strategize our efforts. What is your take? This is my question for both of you. Thank you.
まず私は申し上げますけど、
First, virus always changes. So because of the mutation, that doesn't necessarily mean the vaccination or the shots were not effective. And WHO and other organizations said that there were no evidence available that those shots were not effective. But these new variants information need to be gathered. Not only that, but the other information on safety and efficacy need to be gathered, and we need to confirm that. Well, you talked about everyone across the nation. I have consulted with the many people, but I don't think that there is a necessity to do so. I guess there were two questions. One is a new variant. This mutated strain, as far as data is available from the United Kingdom, the effective reproductive rate is around 40% if the virus expands. So in case that new variant arrives Japan, and if that involves in the outbreak of Japan right now, even now, the medical capacity is at capacity or approaching to the capacity. And if the virus arrives now, which will be a crisis. So I think the border control was decided on the United Kingdom. I think that your question was pertaining to the other countries, and other countries have witnessed those new variants. And there are two kinds of countries who have observed the viruses, the other one who might have, but couldn't emerge those viruses. But anyway, at the border, we need to take sample as soon as possible, and genetic analysis needs to be done as soon as possible. And actually, among the Japan's infections, how much genome research was done? That number was just 10%, which is almost equivalent to that of the United Kingdom. But so far, the infections in the region, there was a time shift. Up to the end of November, we know the overall situation. But real-time basis, once we take the new strain as soon as possible, we do that for many regions. We can't do it, but being ready for these possibility at borders, probably less than 1 week, we can do the genome research almost on a real-time basis. And even today, and I had a conversation with the leader of NIIT, at a faster pace, the technology is available for faster genetic analysis. It doesn't really take months. So other countries other than the United Kingdom from A to Z, including the genetic analysis, have been studied here. And I don't think it takes 1 week or 2 weeks to see the proposals by analyzing those new strains. And I think that will happen. And you asked a question on testing. And as we proposed many times, back in July, the subcommittee put out some proposals. We put one for people who have symptoms, and there are 2 categories for asymptomatic patients. And if they were asymptomatic patients, if they were elderly in care homes, or if the regions are increasing infections, even though there is a 1 case, we do testing, and these moves are very, very effective. However, for the general public, this is the difficulties of the state. The government has to do its part, but the private sector has to play its part. We need to contain outbreak, but it's more like the going back to hometowns and see grandpa and grandma, but also businesses with overseas and a sports event. When we do so, we need to feel safe. And also, when we think about economic activities, we need a safety. And I believe those testing should be promoted more. But we need to overcome those challenges fueled by private sector. So one of the 2 challenges here is that the management of testing and how much quality of the testing by private sector can be ensured. But this is one thing that we need to check. And if the testing has been done in private sector, and if they are testing positive, and then they will be reported to the public authorities. So while conforming those conditions, we will utilize the forces or cooperation from the private sector. That will be desirable.
Vaccine might not be effective. Regarding this point, now infectivity is very powerful, and we agree on this point. But apart from this, for example, people getting more severe. So let's say 10 people tested positive, and how many people would go really serious? We don't really have a solid evidence in this regard. Whether or not such a flight situation is happening, so we have to explore. And this is about the crisis management. So we have to also look at the worst case scenario at the same time. So these have to be studied. And it really depends on the nature of the vaccine of foreign nations as well. Sorry, however, because of time constraints, we'd like to take the last question. Now, Hoshino-san from Asahi. Hoshino with Asahi newspaper. So there was one missing point as part of the leading athlete's question and about the Q&A session in the third session of Prime Minister Suga. So whether or not the former Prime Minister or the Prime Minister has fulfilled accountability, and what is the reason behind what you have said? Regarding whether or not accountability was fulfilled. In this incident, the former Prime Minister, in his press conference, he has delivered his message, and in response to the request from the third session today, he explained himself in the third session. So what's this? I think explanation was given. And regarding the contents, I haven't looked at the TV program. So from here on, I'd like to screenerize that point. Sorry. Prime Minister has a schedule after this meeting. So regarding the people who are raising their hands, one question will be taken from each outlet to the Secretariat by email. And then that way, a Prime Minister's answers will be given to you in writing. Thank you very much for your understanding. Is there any deadline in terms of email? I will let you know by email regarding this point as well. So please take a look at that. So with this, we'd like to conclude Prime Minister's press conference. Thank you very much for your cooperation.